Good morning, everyone. I am Jaldi Bantigi, and this is my report about the process of reproduction. Objectives: first, define fertilization, conception, and pregnancy. And second, explain how the pregnancy occurs and its prevention. And third, identify the following complications of early pregnancy in the growing adolescent. Definition of terms: ovulation. Ovulation is the process when a mature ovum is released from ovary and travels to the fallopian tube for possible fertilization. Fertilization, union of the sperm and the ovum. And pregnancy, the process when an offspring develops within the mother's womb. Although human beings are fully sexually differentiated at birth, the differences between males and females are accentuated at puberty. This is when the reproductive matures, secondary sexual characteristics develop, and the bodies of males and females appear more distinctive. Female puberty usually begins at 8 to 13 years of age. The reproduction maturation of boys lags about 2 years behind that of girls. The physical change of female puberty includes breast development and start menstruation. How does one ovulate? The major landmark of puberty among females is the onset of the menstrual cycle, the monthly ovulation cycle that leads to menstruation or loss of blood and tissues lining the uterus in the absence of pregnancy. The menstrual cycle is from the first day of period until the day before the next period starts. Normally, it lasts around 28 days on the average, but can be short as 21 or as long as 40. Whatever the length, ovulation will happen about 10 to 16 days before the start of the next period. How does pregnancy occur? For pregnancy to proceed, the sperm needs to meet up with an egg. Pregnancy officially starts when a fertilized egg implants in the lining of the uterus. Pregnancy happens 2 to 3 weeks after sexual intercourse. This is redundant, so it was redacted. Conception is the process that begins with fertilization of an egg by the sperm and ends with the implantation. When a male and female have sexual intercourse, the penis fits into woman's vagina. Ejaculation or coming release the sperm via the penis into the vagina. The sperm swim through the female cervix into the womb and finally into the fallopian tube. Once the egg or ovum has been released into the fallopian tube, hundreds of sperm swim up to reach it. Finally, the sperm penetrates the egg into the fallopian tube where fertilization takes place and eventually becomes an embryo. Once an embryo fertilized or once an embryo or fertilized egg attached to the inner lining of the cells floating in the uterus, which officially begins pregnancy. A normal pregnancy lasts 37 to 42 weeks or 9 months. This is measured from the first day of the last period. Pregnancy is discussed in terms of trimesters or 3 months period. Since each trimester is very different from the rest, after 8 weeks, the embryo is officially referred to as a fetus. This is the picture of an egg cell meet up and sperm cell meet up in the fallopian tube. This is the chart of contraceptions of a male. Male usually use condoms rubber sheath that fits over the penis, rolled over the penis, and 80 to 85%. Low cost, easily accessible, and reduced risk of STD or STI. Do not use it with oil-based lubricants such as creams and lotions. Can be effective in prevention of STI and HIV or AIDS. That's the use of the condom. And implantable hormone device. Continuous release of hormones not known. Continuous birth control for 5 years. Implant of capsule and upper arm done by the doctor. And none. Calendar method, or woman predicts the day of ovulation by keeping a calendar of the length or its menstrual cycle. Allows the woman to keep track of safe days before sex. Theoretically 85%, but in reality about 60%. No cost and under control of a woman. Women must keep track with the help of a calendar. And sterilization. Vasectomy. For males and tubal ligations for females. Passageway for the sperm or the egg is surgically tied. Theoretically 100%, but exceptions have been known to take place. Highly effective, permanent, and one-time expense. Doctor performance and operation. None. This is the contraceptive method of a female. Birth control pills contains synthetic estrogen. How it works? Alters natural ovulation cycle. Effectiveness theoretically 99 to 100%, but women have conceived on the pills. And benefits of the pills: low cost, easily available, and controlled by the women. Instruction for use: taken daily after menstrual begins. And benefits other than contraception: none. Birth control or injection given in the first day of the menstruation and then every 2 to 3 months. How it works: none. Effectiveness not known. Benefits: none. Instruction for use given by the doctor, and benefits other contraception: none. Withdrawal: remove of the penis from the vagina before ejaculation. How it works: prevents the semen from going into the vagina. Effectiveness theoretically 85%, but in reality about 70%. Benefits: no cost, under the control of a man and woman involved. Instruction for use dependent of on the man. And benefit other contraception: none. Intrauterine device or IUD. Inserted inside the uterus by a doctor. Theoretically 95 to 98%. And benefit: long-lasting and relatively inexpensive. And instruction for use: inserted by the doctor in the first few days of menstruation, should be examined after few months. And benefits other than contraception: none. That's it, the contraceptive method of the male and female. What are the health effects of early pregnancy in the growing adolescents? There are serious health risks associated with early pregnancy because a young woman's body is not mature enough to handle bearing a child. When a woman is under 20, the pelvic area or the bone surrounding the birth canal is still growing and may not large enough to allow baby to easily pass through the birth canal. This can result in what we call obstructed labor. Obstructed labor is dangerous to both mother and child and requires the help of a trained medical professionals. Under the best circumstances, the young woman will have the operation called cesarean section, in which is made a cut in the abdomen and the baby is removed directly from the mother. A major contributor to high maternal mortality rate is adolescent pregnancy. If a young woman mature, the uterus made during the birth process if she may die because of blood loss. If she is lucky and survive the delivery, she might face fistula due to prolonged labor, and a baby's head can also tear the vagina, causing a hole between the vagina and bladder or between the vagina and rectum, resulting in what we know as fistula. In addition, younger women who become pregnant face higher risk than the older women in developing a number of other complications. This combination of the following manifestations: excessive vomiting, severe anemia, hypertension, convulsions, difficult in breastfeeding if the girl is too young to produce milk, premature and low birth weight babies, infection, prolonged labor, and high maternal mortality or death. The risk of having serious complications during pregnancy or childbirth is much higher for girls in their early teens than for old women. Age of 20 to 30 years are the safest period of a woman's life for childbearing. This is the summary. Summary: reproduction involves the ovum and the sperm to fuse. Their union can lead to a creation of a new life through pregnancy. These and changes that happen during pregnancy so that growing adolescents would be empowered to choose to avert from early pregnancy that can lead to various life-threatening complications. And that's our report. And thank you. Thank you so much.